We take medicine to get better. It's as simple as that. But what if the cure itself could actually make you dangerously sick? Today, we're diving into a really severe intestinal inflammation, and you'll be surprised to hear it's often triggered by the very antibiotics meant to protect us. It sounds like a total paradox, right? A life-saving treatment that, in some cases, can accidentally swing the door wide open for a brand new, dangerous infection. And this isn't just some super rare side effect. It's a story about the incredibly delicate balance inside our own bodies and what happens when that balance gets completely thrown off. Okay, the condition has a bit of a mouthful of a name, Pseudomemranous Colitis. Let's just break that down. We're talking about a serious inflammation of the colon, the large intestine, and it's caused by one specific troublemaker bacterium. The really distinct feature, it literally creates these yellowish plaques, these pseudomembranes, all along the inside of the intestine. So to really get how this happens, we have to start right here, inside your gut. And it's not just some simple plumbing, it's a bustling, sprawling ecosystem, a community of trillions of bacteria we call the microbiome. Seriously, you can think of it as a whole other organ you never knew you had. And when you're healthy, this community keeps itself in a really delicate balance, with all the good guys keeping the bad guys in line. But that delicate balance, well, it can be shattered. And the most common thing to do it? Antibiotics. This is that central paradox we were talking about, how the cure can actually create a dangerous new opening. Just look at the difference here. It is night and day. On the left, you've got a healthy gut. It's this diverse, thriving community where everything's in check. But on the right, after a course of what we call broad-spectrum antibiotics, it's a totally different world. Those antibiotics are kind of like a nuke. They don't just kill the specific bad bacteria they're supposed to target, they wipe out huge populations of our protective bacteria too, and that leaves the colon completely exposed and vulnerable. And into this power vacuum steps an opportunistic invader. Its name is C.Difficile, but pretty much everyone just calls it C.Diff. This is the villain of our story, and it absolutely thrives in the chaos that antibiotics leave behind. Now, C. diff is such a tough enemy because it has this incredible toolkit for survival. First, it forms spores. Think of them like tiny armored seeds that can survive for months on surfaces, especially in places like hospitals. And these spores are ridiculously resistant. We're talking they can shrug off heat, stomach acid, and even alcohol-based hand sanitizers. Then, most importantly, once they find a safe, disrupted gut to call home, they wake up and they start pumping out powerful toxins. So get this, it's not really the bacteria itself that causes the biggest problem. It's the toxins it unleashes. Let's take a closer look at how this toxin-fueled attack really wreaks havoc on the body. C. diff basically has this 1-2 punch with two main toxins. Think of toxin A as the one that just opens the floodgates. It's an enterotoxin and it messes up the intestinal lining, causing inflammation and triggering a massive flood of fluid into the colon, and that is what causes the intense diarrhea. But toxin B is the real demolition crew. It's a cytotoxin, which literally means cell killer, and it's way more powerful. It actually gets inside your colon cells and just starts tearing them apart from the inside out, leading to widespread cell death. So, here's the whole path of destruction, laid out step by step. It all starts when antibiotics disrupt the gut. Then, any C. diff spores you might pick up from the environment just sail right through your stomach acid and wake up in the colon. After that, the bacteria multiply like crazy and start releasing toxin A and toxin B. Those toxins go to work, killing off intestinal cells. And finally, all the wreckage from that attack, dead cells, mucus, inflammatory gunk, it all clumps together to form those yellowish pseudomembranes we talked about. Okay, so with all that damage happening on the inside, what does it actually look and feel like for the person going through it? Let's switch over to the clinical side of things and see how doctors recognize this. The number one telltale symptom, the one that really sets off alarm bells, is just relentless watery diarrhea. I mean, we're talking 10, 15, or even more times a day. And that usually comes with nasty abdominal cramping, fever, and nausea. In the blood work, doctors will see a super high white blood cell count as the body tries to fight back. In the really bad cases, this can lead to severe dehydration and a terrifying condition called toxic megacolon, where the colon actually becomes paralyzed and swells up to a dangerous size. And it's really important to know that C. diff infection isn't a one-size-fits-all thing. It exists on a spectrum. It can range from a relatively mild but still awful case of diarrhea all the way to severe colitis. And at the far end, you have what's called fulminant colitis. That's a medical emergency. It's a super fast, severe inflammation that can lead to a perforated colon and life-threatening infection. So how do doctors know for sure that it's C. diff and not something else? Well, the diagnosis is confirmed with a really modern stool test, usually a NOT. It's incredibly sensitive, and what it does is it looks for the specific gene that gives the C. diff bacteria the ability to produce those nasty toxins. All right, the good news is we are not defenseless here. We have ways to fight back. So let's wrap up by looking at how this infection is treated and, maybe even more importantly, how we can prevent it from ever happening in the first place. Treatment really depends on how sick the patient is. For the non-severe cases, the go-to treatments are specific oral antibiotics that target C. diff, like vancomycin or fidaxomicin. For severe infections, it's often a higher dose of that same vancomycin. But for patients who are stuck in a cycle, getting the infection over and over and over again, there's a truly game-changing therapy called a fecal microbiota transplant, or FMT, which basically restores the entire gut ecosystem. And that cycle of recurrence is a huge problem. See, even after you successfully treat it, the gut is still a mess, the ecosystem is damaged. So after your first C. diff infection, you've got about a 20% chance, a 1 in 5 shot, that it's gonna come right back. But this is where FMT is just incredible. For patients trapped in that cycle, fecal microbiota transplantation has a success rate of over 90%. It's amazing. Think of it like rebooting a computer that's full of viruses. You're not just adding 1 or 2 good programs, you're installing a whole new clean operating system. It works by reintroducing a complete healthy bacterial community that just crowds out the C. diff for good. It's a beautiful example of ecological medicine. Okay, for prevention, this next slide is absolutely critical for everyone to understand. Remember those tough little spores? Alcohol-based hand sanitizers do not kill them. They're just not effective. The only way to get them off your hands is good old-fashioned soap and water. It's the friction from scrubbing that physically removes the spores. That is why it's so important, especially in hospitals and nursing homes. But ultimately, at the end of the day, the single most important way to prevent C. diff is to go right back to the beginning and address the root cause. Judicious, meaning careful and wise, use of antibiotics is the most powerful tool we have. That means not demanding them for viruses like a cold, using them only when they're truly needed, and always finishing the entire prescription. And that really leaves us with this big, thought-provoking question, doesn't it? We live in an age of these incredibly powerful medicines and interventions, but they so often come with unintended consequences. The story of C. diff is just this powerful reminder that as medicine advances, we also have to learn how to be better guardians of the ancient, complex, and vital ecosystems that live inside every single one of us.